Hello everyone, welcome to my YouTube channel. My name is Dr. Sasha Hamdani, and I wanted to start a video series to get people well versed and caught up on the basics of ADHD. So for today, let's start with the only video you'll need to start your journey of learning about ADHD. Let's do an overview and explore what ADHD is, its symptoms, how it impacts your life. If this is something that you find helpful, hit that subscribe button and click that notification bell so you don't miss the rest of the series. Let's get started. First, a little bit about me, just so you know where this information is coming from. I'm a board-certified psychiatrist, an ADHD clinical specialist, best-selling author, entrepreneur, and media expert. And that is a gross, braggy introduction, but let me explain what's behind that. I was diagnosed with ADHD in the 4th grade because I was about as classic of a presentation as there could be. I was loud, disruptive, distractible. I was diagnosed and my life, it just became a lot easier. At that time, ADHD wasn't commonly diagnosed, especially not in girls. So even though I was diagnosed and I was on medication, I didn't really know what ADHD was or what the medication did. So fast forward to graduating high school. I did well enough that I got into an accelerated program that did medical school and college at the same time. So I moved away from home and I was by myself for the first time. And the wheels 100% came off. I couldn't figure out what was going on because suddenly life was just one miserable mistake after the other, and I came really close to being separated from the program. I went home, and that's when I really started learning about ADHD and how my brain worked. And for the first time, I was like, okay, this is something I can grasp and accept. And the rest of medical school was not easy because I was just crawling out of that hole, but I finished. And that experience led me into psychiatry, where then I specialized into ADHD so I could help other people with their journey. So yeah, now you know the voice behind this advice. I thought it might be helpful to make the series from someone who's been both a patient and a provider. So I hope this is a non-judgmental, friendly way to get your basics. And as always, I want this to be an interactive space, so leave comments and questions and I'll do my best to address them in future videos. Okay, so what is ADHD? At its core, ADHD is a neurodevelopmental disorder that affects both children and adults. It impacts the way the brain functions, particularly in areas related to attention, impulse control, and hyperactivity. Individuals with ADHD may struggle with sustaining attention, staying organized, managing their impulses. What causes ADHD? So here's the deal. We don't really know. The causes and risk factors of ADHD aren't totally known, so let's go over what we do know. Current research shows that genetics plays an important role. What does that mean? ADHD tends to run in families, and in most cases, it's thought that the genes you inherit from your parents are a significant factor in developing the condition. Research shows that parents and siblings of someone with ADHD are more likely to have ADHD themselves. Another interesting study was done to see just how much genetics impacted ADHD. So they did a big meta-analysis test on twins to see the genetic effect. The results? The heritability, which is the genetic effect being passed down of ADHD, is estimated at 77 to 88%. If one twin has it, there's a 77 to 88% chance the other one will too. And the number is impacted if that's a fraternal or identical twin. But yes, genetics certainly plays a role. In addition to genetics, scientists are exploring other possible causes and risk factors, including brain injury, exposure to environmental risk like lead during pregnancy or at a young age, alcohol and tobacco use during pregnancy, premature delivery, low birth weight. Let me tell you what does not cause ADHD. Eating too much sugar, watching too much television, parenting, social and environmental factors like poverty or family chaos. A lot of these might make symptoms worse, especially in certain populations. What does ADHD look like? Let's take a closer look at the common symptoms of ADHD. Individuals with ADHD may find it challenging to concentrate on tests, falter on instructions, complete assignments. They may be easily distracted, forgetful, have difficulty organizing their thoughts. In children, hyperactivity may be evident through constant fidgeting, difficulty sitting or standing still, impulsively interrupting others. And in adults, these symptoms may manifest as restlessness, difficulty relaxing, challenges with time management. And to make this even more of a joy for diagnosis, this can look differently based on your gender, stress level, and stage of your life. So that's neat. Let me give you a bit of a hot take. We make a diagnosis through the criteria laid out in this gigantic book called the DSM-5. I will review what's part of that criteria, but to be totally honest with you, I'm not the biggest fan of the DSM for many reasons that I can get into in another video. But for ADHD specifically, I feel like it focuses too much on focus. And ADHD is a complex condition that often travels with mood and anxiety symptoms, so we'll be sure to address those as well. If I put a little asterisk that says not diagnostic, that means while it isn't in the DSM, it's something that's commonly seen. How does it impact you? So let's talk about how ADHD impacts you. Here's the deal. ADHD can last into adulthood. That means there's a pretty sizable proportion of adults running around with undiagnosed ADHD. And maybe they have no idea, or maybe they do. Might not have had access to treatment, or they didn't feel like it was worthwhile to treat at this point. I guess it boils down to, what does it mean to you? ADHD symptoms can cause difficulty at work, at home, or with relationships. Symptoms can become more severe when the demands of adulthood increase, which I'm sure a lot of you have experienced. But if you have gotten this far and the idea of getting a formal diagnosis seems too scary or too real, you're not alone. That's the beauty of the time we're in. There's so much accessible information online. So if you want to start exploring your brain, start here. So there. Good job. You made it through this video. You got the basics. You literally know what ADHD is, what it looks like, and started thinking about how it may impact you. Is that enough? Probably not. But those are the building blocks that we can really start laying some more information down on top of. If you've still managed to keep your focus through this, then stick around for the next video on the 10 questions you need to ask yourself if you suspect ADHD. Based on how you respond, you can start to dive into the rest of the series. Ready?